Welcome to the Red Clinic podcast. I'm Dr. Schwalen, licensed psychologist and specialist in the treatment of eating disorders. Today, we're going to do what we do best and provide some education about eating disorder treatment. We're following up on the third episode in a 3-part series about what it's like to visit with a provider, to get some therapy sessions, to meet for the first time, and what it all looks like. So today I have our guest, Lee Shelton, again. Thank you for joining us.
Absolutely. Glad to be back.
So last week you were a client attending a first initial assessment appointment or an intake appointment.
Yes.
And so at that appointment, I gathered just a bunch of background information in all different categories of Lee's life. And I was able to formulate my diagnostic impressions. It seems like, you're pretty well adjusted. There was some things that I wanted to follow up with you on. And so we're going to do that in today's therapy session. It's going to have more of a Red Clinic focus. So last week I didn't really stick to that eating habits and the point that he made about forgetting to eat, because I was really just trying to give you all out there a taste of what a full appointment would look like in general. Okay, so today we're going to do a little bit of follow-up on that and then show you what maybe a first therapy session can look and feel like, just to help with some of your nerves or questions about the whole process. So you ready, Lee?
I'm ready.
All right, so let's act like this is our first therapy session together. All right. Hey, Lee, it's good to see you.
Very good to see you.
How was the week?
It was good. It was busy, but it was good.
Okay, and so what I want to do today is, since it's our first therapy session, is just kind of go over the results of the assessment with you, give you a little bit of feedback. And then I actually had a few questions that I wanted to follow up with you on, so that way we can create a treatment plan together.
Sounds good.
All right, so let me just remind you about confidentiality. Remember, I have some limits. There's just some situations where I won't be able to keep things to myself. Mostly if you were thinking about hurting yourself, or if you knew if anyone else was in danger, I would have to do everything I can to keep you safe. And then if a court ordered or insurance asked, or if you released information, those are pretty much the main instances where I would have to give up some information about you. Do you have any questions about any of that?
No.
Okay. So some of the things that I wanted to follow up with you on, last week when we talked, I asked you about what happens when you get stressed. And if you remember, you mentioned sometimes you can forget to eat.
Yes.
So let's talk a little bit more about that. What did you mean by that?
I guess I just get so focused on my work and just trying to make sure everything gets done that just kind of becomes a bit of an afterthought, or even just absolutely forgetting to do it.
Okay. And so how often would you say that happens?
Probably a couple times a week.
Okay. So a couple times a week, you're getting to the point where you're just too busy and you're forgetting to eat.
Yes.
Now, how many meals a day would you say you usually eat?
Probably just lunch and dinner, and then if I forget, lunch is the meal that would be forgotten, and so then it would just be dinner at that point.
So sometimes, at least a couple times a week, you're only eating one meal a day.
Yes.
Okay. All right. So let's do this. I want you to think about yesterday, for example.
Okay.
Let's do just a 24-hour recall. Tell me what you had for breakfast, lunch, dinner, if you had any snacks, and what you drank for the day.
Okay. So when I wake up, I generally make a cup of coffee. And so I did that yesterday. I did not eat breakfast. For lunch yesterday, it wasn't the most stressful day. So yesterday I was able to take some time and get lunch. I had a salad, just a Greek salad, and then some water with that. And then I probably wouldn't have ate or drank anything else until dinner time that night. At dinner, I had some salmon and some Brussels sprouts, and I would have had a glass of water with that as well. Okay.
And so you didn't skip lunch yesterday.
That's correct.
But on a couple times a week, you are skipping breakfast and lunch.
That's correct.
And not eating breakfast, is that pretty normal for you?
That's basically a constant.
Okay. So that's just, what are your reasons for not wanting to eat breakfast?
I just kind of, when I get up in the morning, I kind of just have a lot of other things happening busyness wise. I think also I've heard maybe kind of limiting meals to 2 meals a day is good as far as the weight loss side of stuff is concerned as well.
Okay.
And so I've kind of able to put off that breakfast and not feel too overwhelmingly hungry from not eating breakfast in the morning.
And so your weight is something that you are concerned about?
Yes.
Tell me about your concerns.
I mean, I graduated high school, was 155 pounds or something like that, and I've gained some weight since then. So just trying to be conscious of that and trying to keep that in line. And so I just kind of read some articles and did some research on YouTube as far as some weight loss stuff was concerned. And so, skipping breakfast was one of the recommendations. And then, and so that's kind of one of the reasons why I'm not that concerned when I skip lunch is it's kind of serving that purpose as well.
Okay. And so tell me about other things that you've tried to do to lose weight.
Well, I'm really busy. As far as the exercise side of things is concerned, I just don't have a ton of time to, hit the gym once a day or something like that. So, every once in a while I do go for some runs a couple of times a week, but, mostly it's just, I've tried to limit, fat intake and that kind of thing. Counting carbs and that kind of stuff, just to try to make sure that I'm limiting that side of stuff to see if I can drop some pounds.
All right. And so do you know how much you weigh right now?
Yes. 185 pounds.
And what's your ideal weight?
Probably 165.
And where did you get that number from?
There's a app that you put in your height and an age, and it spits out an ideal weight.
Okay. And so is there a number, like if you were to ever reach higher than you are now, that you would be really upset about or feel afraid of?
Yeah, it probably like 5 pounds heavier than I am now, because that would be right at kind of the highest I'd ever been. And whenever I saw that on the scale, I freaked out and started trying to make a change.
Okay. And this is when you started skipping breakfast and
Yes.
really don't have concerns about skipping lunch.
Yes.
So you're not able to exercise as much because of your schedule. Apart from skipping meals, anything else that you've tried to do to lose weight?
No.
Okay. So any fad diets that you've ever tried?
I mean, I've definitely tried kind of the keto stuff before. That ended up making things a little bit worse because I didn't probably stick to it perfectly, and some of the meal plans I saw online were it ended up doing the opposite for me. I ended up gaining weight from that situation. But I tried that for a few weeks, and it was just kind of up and down, up and down, up and down.
Okay. Anything else that you've tried with dieting?
I mean, I guess just overall trying to eat a little healthier.
Okay.
But that'd probably be it.
Okay. And then what about any experiences with binge eating?
I mean, there have been times where I have not eaten breakfast, not eaten lunch, and then gotten home and just been really hungry and looked back and been like, oh, I just kind of blew the rest of the stuff I tried to do this today by, eating half a pizza instead of just what I normally would have done if I'd probably eaten properly throughout the day.
Okay. So is that what a binge usually looks like for you? It's like half a pizza?
Yeah.
Is there anything else that you would eat in that period of time?
I mean, there's been times where I've kind of had like mindless eating of sitting down with a bag of potato chips and like most of the bag is gone and realizing that.
And so how often do you think that happens?
Probably once a month. But eating like much, much more at dinner time than I normally would have, probably once a week.
Okay. And when you say much, much more, is that the half pizza that you're talking about?
Yeah, that's probably 3 times what I would normally eat.
Okay. And then what about any times where you've tried to purge? Do you know what that is?
Would you define that for me?
So like any times where you've ever tried to make yourself throw up?
I have not done that.
What about using laxatives?
I have done that before. Yes.
Okay. When was the last time?
2 weeks ago.
And what was the reason?
I saw myself getting closer to that number on the scale.
Okay. So we would, so if you tried 2 weeks ago, when was the last time before that?
Probably 10 days before that.
Okay. So how often are you using laxatives, would you say, in the last 6 months?
Probably 12 times in the last 6 months.
That's pretty accurate reporting. Okay. Thank you for that information. Have you talked to your not your pediatrician, I'm sorry, your physician about any of your concerns with your weight?
Not really, because it just, they never seem to be concerned about anything when they see a number on a scale. And so I just kind of feel like, maybe that's, maybe I haven't hit something where they're concerned, but that doesn't mean I'm not. So.
Okay. And then how long do you feel like, I mean, I know you mentioned like since high school, you kind of noticed a change in your weight, but how long do you feel like concern about your body and your weight has been a part of your life?
Probably, I would say probably the last 10 to 12 years.
And what happened 10 to 12 years ago?
That's when we started having kids 10 years ago. And so that was a change in lifestyle. Life became a little bit less about me and a little bit more about the whole family at that point. I don't know that there would be anything else that's exactly would go along the lines of that. Actually, just like I mentioned before in the intake process, that would be around when my mom passed away as well.
Okay. All right. And then do you ever feel like you're afraid of weight gain?
Yes.
How afraid? Like, how often do you think about it?
Pretty often in the mornings, because I weigh myself every single morning, and so I'm kind of have a little bit of anxiety before I step on the scale, and then kind of just throughout the day when kind of urges to eat pop up and that kind of stuff, I kind of just keep that in the back of my mind if that's something you want to be conscious of.
Okay, so it's there every day, even starting from the morning time.
Yes.
Okay, thank you. You're doing awesome, by the way, talking about some of this stuff. I know it's not easy. It's not something you're usually talking about. Does your wife have any awareness of some of your struggles?
She knows that I stopped eating breakfast and that kind of stuff, but not really as far as me talking about any type of like anxiety with the scale or anything like that.
And so how do you think she would respond if she knew that this was going on for you?
I don't know. I don't think that that she has a concern as far as any type of weight gain is concerned for me. Like that's never come up, and anytime I've talked about that, it hasn't been something that she's been like, "Oh yeah, you do." So she's always been supportive as far as like eating healthy and that kind of stuff. But I don't know. I think I'm not sure how she would respond to this.
Okay. All right, a few more questions. Okay, you're doing great. This is just really good follow-up information so that, again, we can just figure out ways to help you best. Do you ever feel guilty after eating?
What we talked about as far as that half pizza or whatever it happens to be, at that point, I would say yes to that.
And then what do you normally do after you feel guilty?
I kind of think about the next day and how to avoid having to have needing to kind of hit that one meal and kind of fill up off of that one meal. And so try to think through spreading it out a little bit better than maybe I did the day before. Maybe some planning changes. Okay.
So you're thinking through for the next day. And then do you feel like that's going to be when you're also more likely to use laxatives?
Wow, I haven't thought about it before like that, but I would say that would kind of making up for that. Those things do probably parallel more often than I would have even thought about before you asked that question.
Okay. And I don't want to make any assumptions. I know we've kind of touched on you've been trying to lose weight because you view yourself as overweight right now. But how do you feel about your body?
Overall, I would say overall pretty positive, but I just, seeing myself in the mirror without a shirt off and just kind of seeing a little bit of the stomach there and that kind of thing would make me feel a bit uncomfortable. Okay.
And so looking at yourself in the mirror, you notice that like your stomach area. Do you do any kind of other types of body checking?
Not really. I kind of avoid the mirror more often than not, probably. So
Okay.
there's probably the opposite of that, actually. It'd
Okay.
be not body checking.
All right. So, I mean, that, the line of questions that I just did with you, that's really common for what more of an eating disorder assessment would look like. There's definitely more investigation now at this point. So what I would like to do is actually refer to the Red Clinic, right? And get a dietitian involved to do a nutrition assessment with you. What we do is we work together. Okay, so you would keep working with me as your therapist. I would get the dietitian involved on my team just so we could make sure that we are doing what we can. First, to take care of you from a nutritional aspect, but then also from a mental health aspect. Sounds like it's taking up a lot of your mental space. You're thinking about it from the first time you wake up in the morning. You're adjusting what you eat, and kind of your whole day revolves around, maybe the number on the scale or how you're feeling about yourself for the day. And so I want you to know there is relief. We can absolutely help you find that. Because at this time, it does sound like you're potentially meeting criteria for an eating disorder.
Wow.
Is that a surprise to you?
I just kind of felt like this was what a lot of people did as far as like following some of these diets and doing a little bit more, I would have called it controlled eating and that kind of stuff. So I wouldn't have thought about it in these terms before.
Yeah. And I mean, what you are alluding to is really a common misconception about eating disorders. So, your experience that you described, it's taking up a lot of space mentally for you. It's what you're thinking about pretty much all day. You're changing the way you navigate through the day based on food and caloric intake. You're doing what we call restricting during the day, coming home and binging at night, the guilty feelings afterwards, and then even sometimes purging or making up for all the eating that you did do at nighttime, feeling kind of out of control versus more in control, because sometimes you're really controlled and you're restricting, and then other times you're out of control and you're maybe binge eating, right?
Yeah.
And then you're doing something to make up for that. And then with all of that, you're having like a sense of guilt. And then through therapy, right, through more sessions, I can work with you to find out if you're also having a sense of shame, like the feeling of I'm not good enough or something's inherently, just not right with me or for me. We would work on that. Now, the nutrition assessment, the reason that's so important is because I just don't do my job without a dietitian, okay? So I know that the gold standard evidence-based approach to the treatment of eating disorders is to include a multidisciplinary team. So that would be me as the psychologist, the registered dietitian, if we ever needed medical doctors on board, or even a higher level of care treatment team, I would absolutely let you know that. But right now we're still like in the assessment process. I'm still trying to find out, a little bit more information that my dietitian can ask about, and get real specific about from the more of a medical perspective and a nutrition perspective. And then we'll be able to really guide you in the right direction. Okay, so if we can keep you outpatient, we will. But if it feels like we need a little bit extra support during the week, we will let you know that too, and we'll help facilitate that for you.
Okay.
Okay, do you have any questions about any of that?
I don't think so right now.
Okay, so since this is a therapy session, do you want to further process the eating disorder, or do you want to work on something else from the week?
I think that probably further processing the eating disorder would be good because this is like new information to me at this point.
So what do you feel like doing now that you know?
It is, I just kind of something I need to process through because I just haven't thought about it even close to these terms before. Like I would have kind of felt like for the most part of what I was doing was kind of healthy. And now I'm hearing that's not the case.
Okay.
I knew the laxative side of stuff was probably not the best thing, but other than that, whether it's intermittent fasting or whatever you call it, that's kind of what I was trying to do, and some semblance of that, and put together with a couple of other things. So I don't know. I just I'm just thinking through everything right now.
And that's that's fair, right? I mean, I just gave you some pretty big news. You have to wrap your head around that. Do you feel like you could loop your wife in on this and talk to her, or do you have support people outside of here that you could share this with?
Yeah, I definitely do feel like I could bring my wife into this.
Okay, so you can. I'm happy to hear that you can bring your wife into this, and I absolutely want her to join sessions whenever possible because I'm happy to provide education. Since this is, pretty big news and it's new for you, I want you to know that, tonight when you go home, you might be a little extra tired. I mean, we did a lot today. We uncovered an eating disorder, and it's your first time ever thinking about it that way. So what are some things that you can make sure to do to take care of yourself tonight when you get home?
Yeah, I think I can just, take a little bit of time to myself to process and not let myself get too overwhelmed with this. I'm also going to just make sure to, I'm going to have a good meal with the family tonight and just kind of focus on that side of things and just I'm going to take some time to myself and take some time to be with the family.
Okay. And then the other thing that I want you to know is that it's really tempting to, Google and do some research from now until the next time we meet. Just be careful with some of that. If you want a really good resource of information, I highly recommend the National Eating Disorders Association. It's NEDA.org. It's a good website for just general information about eating disorders. And I think they even have a resource on there for like, now you have the diagnosis, now what? That kind of thing.
Okay.
So that's the source that I trust if you're going to do some research outside of these sessions.
Okay, perfect.
Okay. How do you feel right now?
A little bit overwhelmed. But at the same time, I feel just good about having this information and knowing that there's going to be a plan to move forward.
Okay, I'm really glad to hear that. If you feel overwhelmed about anything, I want to recommend that you just write down your thoughts. If you have any questions, feel free to email me before I see you again next week. I'm always available by that, and I can kind of just send you quick links or quick information because I know information really helps us when we feel overwhelmed. And if you want, we can end the session today by doing a little bit of deep breathing.
It'd be perfect.
Okay, so what I'm going to have you do is just close your eyes, and we're going to do some 3-3-3 breathing. So I'm going to have you breathe in for 3 seconds, hold at the top for 3, and then let go for 3. Okay, so just listen to my voice. We're going to do this 5 times. So take a deep breath in. Good, hold at the top. And let go. I'll do it again. Take a deep breath in. And let go of all your stress. Let's take a deep breath in. Feel yourself relax. And breathe out. Take a deep breath in. And let it go. Last one. Take a deep breath in. And then let it go. So you're going to be okay. We're going to get you through this.
All right.
All right. Thank you.
Thank you.
And there you have it. There's a sample therapy session. It was kind of an assessment because of the eating disorder specific questions that I wanted to give you a sample of, and then a little bit of processing at the end. If we had more time today, I would definitely work closer with Lee to help him feel like he could leave the session today with a good plan for how to move forward. If he was in my office, I would have walked him to the scheduling office to get that nutrition assessment scheduled so that he would have a good plan for what the next steps are and feel secure in whatever his treatment plan next steps should be. What do you think, Lee? What was that like for you?
Again, there was just a lot of questions that came up that caused you to think about things in a way that you wouldn't have thought about in your own head. And so having outside questions happening, it just causes you to approach things. It gives you a different perspective.
Okay. And so, I mean, can you provide some examples? Like, how did it change your perspective? Yeah.
So asking about just kind of seeing how things progressed in the questions and getting deeper and deeper. A lot of times you don't think about things as root causes or connected to other things until you're asked about them. And then it's like, oh, there's the connection there.
Yeah.
So when you're asking me when stuff started and what was happening in my life when that was taking place, it's like, oh, that's how this could connect with this. And so you start to just form those connections in your own mind and realize that, sometimes there's outside forces that you need help processing and that kind of thing.
Yeah. And you made that connection. That was really cool that you put those together. sometimes, clients can do that themselves. Sometimes the therapist will say, hey, do you think these two things are related? Or do you notice that when your disordered eating thoughts and body image issues started is also when these things happened in your life? And that's really common with eating disorders. Finding that there's like some triggering moment or event that happened in their life, and that's kind of, pre-eating disorder to post, eating disorder time. All right. Well, thank you for joining again today.
Yeah, I'm glad to be here.
I'm glad you came. All right. Well, there you have it. That's the Red Clinic podcast for today. Tune in next week. Can't wait to see you. Thank you.